We begin with confusion and chaos for the millions of Australians with high cholesterol. After a recent ABC documentary questioned the long-established link between cholesterol and heart disease, 3 in 4 doctors are now reporting patients have stopped taking their anti-cholesterol medication, many without consulting a GP. And as Georgia Main reports, some doctors believe it's just a matter of time before lives are lost.
If you go off your statin and you're at high risk, you are at risk of dying as a result.
At least 700,000 Australians are out there at high risk of having a heart attack or stroke in 5 years.
Around 3 million Australians take cholesterol-lowering drugs called statins.
I'll follow the road which led us to believe that saturated fat and cholesterol cause heart disease and reveal why it's been touted as the biggest myth in medical history.
Since the ABC science program Catalyst aired a report suggesting high cholesterol doesn't cause heart disease and most people are wasting their time taking statins, 3 in 4 doctors are reporting patients have stopped their medications.
It does worry me, especially if they've already had an event.
A survey of 150 doctors found that half of the patients who have stopped their drugs are considered at high risk of a heart attack. The ABC's own health expert, Dr. Norman Swan, says it's crucial people are aware of their risk.
One story I heard from a professor of cardiology in Sydney was he had a patient with heart failure who thought it applied to all her drugs. She stopped everything she was on, and 10 days later she was in intensive care in a major Sydney hospital.
There was an insinuation that saturated fats, cholesterol, dieting, lifestyle modification in those regards were probably not important for our patients with vascular disease, and that's totally wrong. I think it's very mischievous and misleading for our patients.
Epworth Hospital cardiologist Dr. George Promos has been inundated with calls from patients who are confused and concerned about their medication.
I think pretty much every patient who's had one event should be on a statin, and the data for that is beyond doubt.
Over the age of 45 is the correct age for Australians to consider getting a healthy heart check. Now, if your risk is high, and we call high being 20%, that in fact is a 1 in 5 odds that you'll in fact actually have a heart attack or stroke in those 5 years. That means we need to do something about it.
Cholesterol-lowering statins are the most prescribed medicines in the country. We spend more than $1 billion on them each year. Dr. Robert Grenfell from the Heart Foundation says heart disease remains the #1 killer of Australians.
We consistently and continually evaluate the evidence to look and see that we're giving the Australian public the right advice. At this stage, our advice is fixed in this area because the evidence has not changed our viewpoint that saturated fats are in fact something we should minimise in our diet.
I'd say probably 70% marketing. I'm not saying people shouldn't use statins, but I think they're overused. 16 million prescriptions written for statins every year in Australia, and probably 500,000 of those are necessary.
It's a debate which has been raging for years, but it's a necessary debate according to consulting cardiologist Dr. Ross Walker, who believes cholesterol levels don't always reveal the full story.
The best predictive test for heart disease is to have a coronary calcium score using a CT scanner. It's just a snapshot of your coronary arteries which measures how much muck you have in the walls.
The calcium score can show if you're at increased risk long before other signs and symptoms occur.
I'm Associate Professor Senek.
Nice to meet you.
Nice to meet you.
56-year-old lawyer Gady Kolsky was surprised by his recent cholesterol score of 5.6.
I was very surprised and a little bit concerned because the lifestyle that I lead is extremely healthy. I exercise 4 times a week and I don't have history of this in my family. So none of this really should apply to me. The prospect of going on medication is something that I'm not willing to do.
Gady's GP suggested statins may be on the cards, so he's come to the Monash Medical Centre to investigate further.
Gary, this is fantastic news. We have just looked at your scan and absolutely got no cholesterol whatsoever. This automatically puts you at a very low risk of actually having a cardiac event. If there had been any cholesterol which has turned into calcium, you would see similar colour appearing in your coronary arteries, and what you can see is there is absolutely no cholesterol.
While Gady's in the clear, what the experts can agree on is that cholesterol is a complex issue.
Although we know a lot of things, there's lots of things we still don't know, and yes, there's lots of room for investigation.
The key message here is that you have to know your own risk of having a heart attack or stroke, and that's a conversation which you need to have with your doctor.
Yeah, and always consult your GP before changing or stopping any medication. Georgia Main, your reporter there.